Access to health care for those who live in rural parts of Appalachia is a major challenge, and transportation is one of the biggest speed bumps.
As part of our Bridging the Great Health Divide series, Kelsey Soto is looking at local organizations meeting patients right at the front door and delivering them directly to their appointments.
Oh yeah, a lot of help, because I don't have the car or nothing anymore.
Whether you live right in the middle of city limits or far on the outskirts of the county line, quality of life can sometimes be determined by how accessible a ride is.
Transportation is a massive social determinant of health. Just your ability to go whenever and wherever you want, which we take for granted.
As the executive director of Faith Health Appalachia, Rory Chapman knows that those who live in rural parts of the region, like Wayne, Logan, and Lincoln counties, may not have a way to get to and from their medical appointments.
It's those way out folks that really have the issues, not only because they're just so far from everything, but because they're so isolated. And one of the things I like to tell people is, you might not have motive care, you might not have TTA, you might not have Dial-A-Ride, you might not have all those services in the areas of the hills and hollers, but what you do have are churches.
His organization is connecting community resources like hospitals and the Mountain Health Network to faith groups and other social services, hoping to improve the lives of those who live and work in the area.
Appalachia is a very, not prideful, but proud area. We are proud of where we're from. We pull ourselves up by our bootstraps, and we get things done for ourselves. We don't like help.
For Joan Coleman of Ashland, without the help of King's Daughters Van Ministry, she wouldn't be able to see her doctor.
And I can't walk. I don't have a car. And so I can call Patty and them, and they're right there.
I'm out back where the Clarks are.
The Van Ministry has been around more than 2 decades, but was initially a part of Our Lady of Bellefonte services before they closed their doors. Staff say they're thankful the program could continue on at KDMC.
It's really a lifesaver for them to be able to depend on us and not have to worry and stress about how they're going to get to their doctor appointments.
Health leaders fear that social isolation and a lack of connectivity to resources means many homebound individuals are slipping through the cracks and not getting the care they need.
And those missed appointments turn into emergency room visits, which turn very expensive and very time-consuming, and really can be the make or break in a person's health.
Nationally, an estimated 91% of households in the U.S. have at least one vehicle in 2017. In Cabell County, an area that offers public transportation, 86% of homes have at least one car.
I have nobody, and I have no way of getting there, so I can always count on these people.
But the real test for those even with a vehicle is ensuring that their transportation is reliable.
Maybe they didn't replace the tires on their car, and so they're either running flat or about to bust because they needed to buy groceries or buy their prescriptions.
Kent Robinson has been driving patients around for 11 years and tells me these relationships last long after drop-offs.
We become their friends, we become their family, and sometimes not only will you see them doing your job, but you might be in your grocery store, or you might be at the mall. They look forward to one of us coming to get them because they know we'll get them there in a safe manner.
Each person taking back the wheel, making sure they're never putting their health in the back seat.
All right, listen, y'all have a good day.
Kelsey Soto, WSAZ, News Channel 3, Ashland.
To learn more about available programs, community outreach, and organizations, we'll have additional information for you on WSAZ.com.